So the way that we use cardiac troponin testing in practice is changing rapidly. Whilst most guidelines continue to recommend troponin as a binary test to diagnose myocardial infarction, lots of groups across Europe and the world have developed really innovative ways to use high sensitivity tests to make earlier decisions to accelerate the diagnostic pathway. The problem with this research field has been it's largely been observational. It hasn't been tested in prospective randomized trials, and therefore the true effectiveness and critically the safety of introducing these early rule-out pathways into clinical practice is unknown. We therefore designed the British Heart Foundation funded HiSTORIC trial, a stepped-wedge cluster randomized controlled trial across 7 hospitals in Scotland to determine the effectiveness and safety of implementing an early rule-out pathway. Our pathway uses a single high-sensitivity cardiac troponin concentration at presentation to identify low-risk patients. It was compared to a standard care pathway which uses serial testing and the 99th centile to rule out myocardial infarction. We observed the implementation of the pathway reduced length of stay by more than 3 hours in our emergency department, and it increased the proportion of patients sent home by more than 50%. And critically, this was observed without any evidence of adverse cardiovascular events in these patients discharged out to 1 year follow-up. So this trial was conducted in 31,492 patients, which gives us robust estimates of safety. Also, we enrolled all patients by randomizing hospitals rather than individual patients, and that avoided selection bias and the Hawthorne effect of the researcher standing over the patient while they are assessed. But I think the highlight for me, the most important finding, is the adherence to this pathway. So over 90% of clinicians followed our early rule-out pathway, despite it being implemented across 7 hospitals, 24 hours a day, 7 days a week, by many hundreds of different clinicians throughout Scotland. And I think that's testament to the pragmatic, simple nature of the high-stakes rapid rule-out pathway.